So this is a 29-year-old female patient who was referred to the Nottingham University Hospital's neurogastroenterology unit. And this is a story that I suspect many are familiar with. So a patient who had repeated episodes of nausea and vomiting approximately once a month near the time of her period. And this nausea and vomiting started approximately 15 years ago after a stomach bug. And in addition to the nausea and vomiting, there was associated pain in the upper part of the abdomen, which is known as the epigastric region. So that explains the epigastric pain. She also had constipation, but there was no blood in the stool, so there was no rectal bleeding. She denied dysphagia, so there was no problems with swallowing, and there was also no heartburn. And over the course of 12 months, she'd had weight loss of 13 kg. And she had a BMI of 21.3. And to put that in context, normal BMI is between 20 to 25, so she was on the lower end of that. She had her, in terms of past medical history, she had a previous appendectomy, so her appendix was removed. And she had a family history of irritable bowel syndrome. She had a panel of bloods taken which were normal. And there was no evidence of any celiac disease. She'd undergone a previous endoscopy, rather a gastroscopy, so a camera down the gullet into the stomach, which was normal, or reported as normal. And she was on 5 medications, and I've highlighted the medications that will be of interest to many of you, and will be of interest and will be discussed in the case in presentations being delivered by Drs. Corsetti and Venkatesan. So the first medication is propranolol. That's a beta blocker. Often it's prescribed for a number of different reasons. It could be for anxiety, it could be for a tremor, it could be for prophylaxis for migraine. Secondly, duloxetine, so this is a tricyclic antidepressant, but I say antidepressant. It was originally licensed as an antidepressant back in the 60s, but there's increasing evidence, well, there is now evidence that duloxetine is very helpful in the management of chronic pain, and growing evidence that tricyclic antidepressants are helpful in the management of problems with the connection between the gut and the brain, which is a disorder of gut-brain interaction, of which CVS is an example. Number 3, ondansetron, a drug that many of you are probably familiar with. It's an antiemetic, so it stops one from becoming nauseous. The 4th drug is oxynorm. This is an opioid drug. It's a fast-acting opioid drug. And this patient was on a fairly high dose of that, 100 milligrams a day. And then Dulcolax, which is a laxative, which is PRN, so taken when needed. This sets the scene for 2 talks. So the first talk providing the USA perspective, second talk is Dr. Corsetti providing the UK perspective, and then my talk at the end is a clinical case solution.